The Maamobi General Hospital needs an estimated 375,000 cedis to renovate the second floor of its maternity block into a functional theatre for labor cases especially, although the hospital does not have a surgeon, hence does not offer surgical services. It somewhat performs minor surgeries and caesarean section for women in labor distress. These are performed at a theatre not conducive for surgical purposes due to its dilapidated nature. A report by Sarah Ofori. This is the health segment.
In outpatients department and inpatient care services, the Maamobi General Hospital renders care in internal medicine, eye and dental, community psychiatry, productive child care, obstetric and gynecological care, among others. The maternity is a 36-bed unit with first and second stage labor rooms.
If we have emergency like a fetal distress, placenta abruptio, and others, we have to move the client from here to theater. We have to put the woman on oxygen. The oxygen cylinders that we have, they are too big, but we normally push them with the client to theater. So if you can get a portable small one that we can put at the bedside of the client before going to theater, it will help us. Even the stretcher we are having is old, dilapidated, that sometimes if my midwives are pushing it to climb the hill over there, it's a big distance for them. We even need a sterilizer. This sterilizer too is old. That way we sterilize our instrument.
The theatre is about 50 meters from the labor ward, and this puts pregnant women in labor distress at risk. Although its staff strength is somewhat adequate, there isn't much to do than to improvise, considering the dilapidated nature of the theatre. Just one of the two air conditioners functions and the other has broken down after many repair works. The ceiling fan then becomes a backup. The risk it poses is a tendency to blow up dust. The operating table is not stable, and its handles to appropriately position the patient for surgery is broken. The roofing leaks badly when it rains, wetting the sterilizing trolley. The door is not standard. It does not swing, and when it shuts, it is difficult to open. Thus, the door is kept open, inviting insects into the room. The taps at the scrubbing room leak, and the sluice where bodily fluids and the blood of patients are disposed of is not functional, attracting insects and emitting a stench.
The recovery is a 3-bed capacity recovery. So during days when we are overwhelmed over here, patients are transed out even when they are not recovered from anesthesia. The setup is not the standard. The sections that are supposed to be in place for infection preventions are not in order. Looking at a standard theater, it's supposed to be at a degree of 20 to 24 degrees Celsius. But as you are here, cameraman, you can see it's very warm in here, and it's not conducive for our patients because you don't have air coming in and then going out. Equipment to enhance critical care we don't have here, such as the perfusers we don't have here.
Management of the hospital has plans to relocate the theatre to the maternity block.
We want to relocate our current theatre to a new place, and we will require anesthesia machine. Yes, an anesthesia machine. And if you look at our maternity block, it's a whole block. But you note that the top floor, that's the last floor, is lying fallow. We are not using it because we need to look at the electrical wiring. It's been there for years. So we need to change the wiring. And few of the plumbing materials, we have to change the plumbing architecture there.
The cost of renovation is estimated at 375,000 cedis. Hence, management is appealing for assistance. Notwithstanding its challenges, one cannot help but to notice the security cameras, advantage units, which can aid investigations in the case of medical negligence. Sarah Ofori, GBC News, Maamobi General Hospital, Accra.